Our next speaker is Dr. Leonardo Rangel Castilla. Dr. Castilla is an associate professor of neurosurgery at Mayo Clinic in Rochester. He's going to speak about flow diversion devices, update, and new uses.
Good morning. Thank you, everybody, for having me here today. Thank you, Ben, for the invitation. Thank you, Dr. Friedman. Endovascular technology is evolving, and every 2-3 years we have a new device. Sometimes it's hard to catch up on all these devices, and within the next 20 minutes or so, I will talk about flow diversion. It's a new technology that was approved in 2009, 2010 by FDA, and so we have almost 10 years of experience with the device. We're currently on the second generation of the device that obviously improved from the first. The first initial stent that came out in the market and had some complications or had some difficulties in deploying this new stent. It has significantly improved, and since the original flow diversion stent, we have some others. I'm just going to briefly try to make it simple to understand how this device works for those who are not familiar with this. So you know that aneurysms form from a normal flow that instead of going into the parent vessel goes into a point of weakness on that vessel, and eventually an aneurysm forms. What this device does is changes the flow by putting this device at the bottom of the aneurysm. Instead of going into the aneurysm, it eventually goes into the parent vessel, and what happens to the aneurysm is that it slowly thromboses and eventually disappears. That process takes about 6 months, 6 or 7 months, more or less. Some patients do this in 1 or 2 months, but in general it takes about 6 months. So flow diversion is more used on non-rupture aneurysms, because on rupture aneurysms what we want is to secure the aneurysm right away, and certainly flow diversion does not secure the aneurysm right away. It gives some protection, but it still is not securely. We have used flow diversion in some cases with rupture aneurysm, but we try not to. And this is what we want to achieve at the end of the day. The stent itself is just a scaffold for the endothelium to grow over that stent and eventually make that aneurysm go away. And this is some of the slices that we have done in our lab up in Rochester using a rabbit model. You see the effect of the flow diversion.